Good afternoon. The webinar will begin momentarily. Good afternoon and welcome to today's webinar, Exploring Health Together, What the All of Us Dataset Can Teach Us. Please feel free to use the chat to share your questions, comments, and reflections throughout the session. You will be asked to fill out an evaluation survey at the end of this webinar. Your insights help us to make programming decisions. So please take a few moments and fill out the survey. We do really want to hear from you. Thank you. Next slide, please. We will begin this afternoon, of course, with welcome and logistics, which we've already done. Reminding you again to feel free to use the chat for questions, comments, emojis, the numerous way we can express ourselves. We will then hear just a little bit about Community Campus Partnerships for Health. Then there will be a presentation by Dr. Hood, and our next presentation will be by Ms. Stephanie Tillman, followed by Q&A, announcements and updates, and attendee insights, and of course, closing remarks. Next slide, please. Who we are. Community Campus Partnerships for Health promotes health equity and social justice through partnerships between communities and academic institutions. We view health broadly as physical, mental, emotional, social, and spiritual well-being, and we emphasize partnership approaches to health that focus on changing the conditions and the environments in which people live, work, study, pray, and play. Next slide. And here is our CCPH, All of Us Research Academy team. I'd just like to draw your attention to our Executive Director, Alan Richmond, and to Keisha Vines, our colleague who is part of our production team today. Next slide. I would like to take this opportunity to introduce Dr. Sula Hood. Dr. Hood is a senior research scientist at RTI, a nonprofit research institute. She has over 17 years of experience with a focus on health communication and community engagement in genomics. Dr. Hood is a co-investigator on RTI's All of Us Engagement and Retention Innovator Award, and she serves as co-lead for the All of Us Researcher Academy. Dr. Hood, thank you for being here this afternoon.
Thank you so much. Okay, so I'd like to just start out before I delve into talking a little bit about the Researcher Academy by introducing my research team. We have a large group of dedicated and talented researchers who make our Researcher Academy work possible. So too many to name individually, but do want to let you know that there's a lot of people behind all of the work that I'm going to be sharing with you shortly about the Academy. Thank you. Next slide. All right. So before telling you specifically about the Researcher Academy, I do want to provide a little bit of background about the All of Us research program. So All of Us is a historic effort by the NIH to recruit 1 million or more people from a wide range of backgrounds in the US to learn about their health, to inform precision medicine and enhance individualized healthcare. Okay, so now I'll tell you a little bit about how the All of Us Researcher Academy fits into that. Our program focuses on providing training and technical assistance to researchers who utilize the All of Us Researcher Workbench. And that is the online platform that actually houses All of Us data. Our speaker, Stephanie Tillman, today she'll tell you a little bit more about the Researcher Workbench. Our Researcher Academy has a wide range of programs. And if you can share on the next slide here, I can talk about some of those features. All right, thank you. The goal of our Researcher Academy largely is to establish a large and sustainable network of researchers who really are able and equipped to effectively analyze all of us data. And we really do a lot of our work to promote access to and utilization of the researcher workbench for among researchers across the US. We focus on achieving our primary goal through a range of objectives. We do work to raise awareness and assess the needs of researchers. We have various experiential learning opportunities such as internships and fellowships. We also have a large training curriculum that is freely accessible and tuition free, that includes a lot of resources that can help equip people to effectively analyze the data. We engage in partnerships with various different organizations such as CCPH, and we draw insights from experienced partners so that we can apply them to the Researcher Academy and make it all the better. We also engage in ongoing evaluation of our various different program activities. We're always looking to make sure that what we are doing ultimately meets the needs of the researchers that are benefiting from our work. Next slide. Right. So one program component in particular that I want to acknowledge is our Institutional Champion Awards. And this is a award in which we provide funding to institutions and teams of researchers at institutions to support them in analyzing all of us data. These teams of researchers tend to be interdisciplinary in nature. They may be teams of faculty members, students, and postdocs. To date, we have awarded institutional champion funding to researchers at 21 institutions, I'm proud to say, across 4 groups since 2022. Next slide. All right. So as I mentioned, over the past several years, we have developed a wide range of course offerings on various different topics to be able to enhance researchers' ability to analyze all of us data, but also to support them in other areas related to research, including writing up their results and preparing for publications, preparing for grants, for example. Um, this research resource is, as I mentioned, tuition free. It's freely available. And we have it hosted on our Amaze platform, which is a online learning platform hosted through RTI. We do have a course catalog that you can access. The link is here and it will be available when the slides are shared out, or you can scan on the QR code here so that you can learn about the various different courses that we have, and you can go on and attend those courses or access those resources at your own pace. Next slide, please. All right. And then also, I'd like to uh, drive your attention to our Researcher Academy newsletter. It's called Connections. We send out a newsletter quarterly, and we've grown to almost 800 subscribers. This is a great place for you to learn about resources for within the All of Us research program in general, but also any types of programs, events, activities that we might be offering through the Researcher Academy. We do do also utilize our newsletter as a space to celebrate the various different scholars that are affiliated with our Researcher Academy and to be able to highlight their work. So we have a space for researcher spotlights. Announcements from the Academy. We also like to provide announcements from some of our partners. So it's a one-stop shop for a lot of great information. You can subscribe very quickly and easily by scanning the QR code or visiting the web link later. Next slide, please. All right. So now I'd like to introduce our featured speaker for today, Stephanie Tillman. So Stephanie Tillman is a statistician and a data analyst with a master's in statistics, driven by a deep passion for using data to advance health research and educational outcomes. She currently serves as an adjunct professor of statistics, where she combines academic insight with real-world experience to inspire the next generation of data professionals. With a strong foundation in research, Stephanie specializes in analyzing complex health and education data sets to support evidence-based decisions and promote meaningful change. So I'm going to pass it over to Stephanie, and so she'll first be talking a little bit more about the All of Us Researcher Workbench and the sign-up process, and then moving into her specific presentation for today. On to you, Stephanie.
Awesome. Thank you so much, Sola, and thank you all for joining us today. Super excited to be presenting my presentation on the analysis that I've done and a little bit of information on the All of Us Researcher Workbench. So let's talk a little bit about the All of Us Researcher Workbench. The All of Us Researcher Workbench is a cloud-based platform that houses the All of Us participant data. This centralized secure platform currently contains the following participant data in two different tiers. So the first tier is going to be the registered tier, and this tier is going to contain individual level data, but it's only available to approved researchers on the researcher workbench. And so this data set includes things like EHR data, wearables data, the surveys, as well as physical measurements. However, if you want to take it a little bit a step further, you can also go into the controlled tier level. Now, the controlled tier level is going to contain a little bit more of deeper data, things like genomics data, sequencing, and things like that, along with the EHR and survey data as well. There's quite a bit of data available in the researcher workbench. So we do have a few different survey data available, as well as physical measurements, genotyping with arrays, EHR data, whole genome sequences, Fitbit records, and then structural variant data, and then long read sequences. So there's quite a bit of information that you can look into with the All of Us Researcher Workbench, and some data available for different types of analysis. Next slide. So prior to getting access to the researcher workbench, you do have to have a DURA. This is a data use and registration agreement. A completed data use and register agreement allows researchers to access the All of Us Researcher Workbench with an institutional sign-off. So if you're connected through a university or another institution that has a DURA, you should be good to go. This DURA provides access to the registered tier and the control tier, and they are administered by the Data and Research Center at Vanderbilt University Medical Center. So if you're interested in using the All of Us Researcher Workbench, the first thing that you're going to want to do is see if the institution that you're attached to has a DURA. Now, if you're someone that is doing some individual research, it might be good to see if you can get connected with the institution or some type of platform that's able to obtain a DURA and go that way. But if you're interested, feel free to scan the QR code. There also is a way to check the institution that you're with already has a DURA, so that you don't have to go and obtain the DURA to get access. Next slide. Alrighty, and then so if you're interested, there's a few steps for setting up your account and registration. And so the first thing, as we mentioned, is to confirm your institution's agreement. through that DURA. And then step 2, you're going to need to create an account and verify your identity. And then step 3 is going to be complete the mandatory training. And then step 4 is going to be to sign the data user code of conduct. Now, I know we have 4 different steps here, but all the steps can be completed pretty fast. So that is good if you are interested in, doing some research through this platform. Next slide. And then the last few things is when you're setting up your account, you'll get a question of how did you learn about the All of Us Researcher Workbench? So you'll want to, select how you learned about this platform. And then did you learn about the All of Us Researcher Workbench from any of these program partners? And if you have, you'll want to click the program partners that you have learned about the program through. Next slide. Alrighty, now I want to go into what I think is the most fun part about today's webinar is the analysis that I've done through the researcher workbench. And as I'm going through, I'm happy to take questions at the end, or if you want to drop some questions inside the chat, feel free to do so. My goal of this webinar is really to show you all what you can do with the platform, some of the data that you'll have access to, and then some of the coding that you can do as well to be able to answer your research questions. Some of you guys may be joining because you're interested in doing a publication, or you're just interested in finding more research. And I'm just here to tell you that there's a lot of things that you can do, different routes that you can take to be able to answer some questions that you might have. And I'm happy to share, what data is available, what you're able to do, and what you're not able to do in the workbench as well. And so my analysis is focusing on intersectional differences, and we're going to be exploring healthcare barriers and access using the All of Us Researcher Workbench. Next slide. So just to go over a little bit of introduction. So we're focusing on mental health disorders because they affect millions of individuals annually. Things, lifestyle factors, and related social variables like economic hardship, food insecurity, and discrimination play a key role in shaping mental health outcomes. And understanding how demographic factors interact with factors such as economic standing can help identify where differences exist and inform intervention. Next slide. So there's a few main research objectives for today. The first one is going to be examining how social determinants of health, this is things like income, housing, food insecurity, and discrimination, predict the likelihood of having a mental health disorder. So in this analysis, we're going to be looking at disorders like anxiety, depression, bipolar disorder, and PTSD. And then we're also going to be exploring how intersecting identities, things like race, gender, sexual orientation, influence disorder risk and shape disparities in mental health outcomes. Next slide. So there's a few things as far as the researcher workbench, that they have to go ahead and get you started with your analysis. So I want to focus on cohortability. Now, if you've done an analysis before, there's things like inclusion, exclusion criteria. The good thing about this platform is that you're able to go into the platform and go ahead and start building your cohort. So in this analysis, I'm taking a look at people with different mental health disorders. So things like anxiety, depression, bipolar disorder, or PTSD. And so I went into the cohort and chose individuals that have those different types of disorder. I'm also taking a look into individuals that also completed the social factors of health survey. So as I mentioned before, when I was talking about all the different things inside the data set, there are different surveys. And so in this one, we're talking about social factors of health. And so I'm using that survey as well. These were merged with respondents without a disorder for comparison. So I had 2 different data sets. I had a data set with people that had either the anxiety, depression, bipolar disorder, or PTSD disorder, and then also completed the survey. That was then merged with the respondents that didn't have a disorder. And so the disorders in this analysis were chosen due to high prevalence and strong links to social factors in literature. And then we're excluding things like missing data and key predictors. Next slide. So, of course, when you're doing an analysis, you're going to want to do some data preparation and variable recording. Now, the researcher workbench is a great platform as far as, the cohort building and things like that. But I do want to let viewers know on this webinar that you do have to still prepare the data. And so the good thing about this platform is that it does offer different coding softwares like R, SAS, and Python for your analysis. And this is going to be through a Jupyter notebook, the R and Python R, and then SAS is linked through another one. So if you're familiar with those coding softwares, then you'll be good to go for your analysis. But you'll definitely have to do some data cleaning, data wrangling, and possibly some variable recoding based off of your goals of your analysis. And so for my data preparation and variable recoding, I was doing things like creating a binary outcome variable. So when I merged those data sets together, remember I had a data set of people that had a disorder, the anxiety, depression, PTSD, or bipolar disorder. And then I also had a data set of people that didn't have a disorder. Once I merged those data sets together, I created a binary outcome variable. One, if they had a disorder, zero, if they didn't have a disorder. Could you go back to the previous slide, please? The previous slide. Thank you. Oh, uh, yes, this one. Thank you. And then we're going to be taking a look at some different variables as well. Things like housing concern, food insecurities. These were averaged on a Likert scale, and then they were binned, things like low, moderate, or high, whether they had food insecurity, housing concerns, no or yes, stable housing, housing concern, things like that. Gender, race, and or sexual orientation were also recoded for interpretability. So, if there were some lower numbers in certain areas, those things might have been recoded. And then also missing or unknown skip categories were excluded. And so I wanted to provide a snippet of the code. I was not able to provide a snippet of the data for this webinar in case anyone hasn't went through the training, but I did want to provide a snippet of the code for those that may not be familiar. This is a snippet of our code syntax, but these are some of the things that you'll have to do and that you'll need to know how to do in order to complete your analysis successfully. So as you can see, we have this code in the program. I'm using the mutate function, and I'm recoding different variables out for my analysis. Next slide. And so now I'm going into the statistical testing, and then we'll talk about some of the results that I saw based off of some of the things that I did. But for this analysis, we're going to be doing a logistic regression. And so this is going to be focusing on the binomial family. Remember, I created a binary variable that, is our outcome variable if they have the disorder or if they don't have a disorder. And this statistical testing is being used because it includes both categorical and continuous predictor variables, and is estimating the relationships between predictors and the likelihood of the outcome, and also produces interpretable results through odds ratios, which indicate how each variables affect the odds of the outcome. Next slide. And so here is a snippet of the output results. Now, I'm going to kind of break this down in case we have some people that are new to statistical testing. But here, what we have at the top is a call function. And we see we have our GLM. And what we have is a breakdown of the output of all of our variables. So we have our binary outcome variable. Remember, if they had a disorder versus if they didn't have a disorder. And then we have all of our other variables in the sequence as well. So things like gender, age, race, income, education, housing, food insecurity, and things like that. Recoded is my code knowing that, okay, I recoded this to be in a certain form. And so from this output, we can see things like social determinants like age, income, housing, food insecurity, and harassment are strong, significant predictors of mental health disorder risk. And then I've also highlighted some in red as well for you all to see. And then also intersectional identities, so things like sexual orientation also matters. So straight individuals have significantly lower predicted odds of a disorder. And then the findings reinforce the impact of structural and social vulnerabilities on mental health and supporting targeted prevention and support efforts for low income, food insecure, and non-straight populations. Next slide. And so I always like to attach visualizations in addition to outputs because I think it's very helpful in terms of being able to understand the story a little bit better. So I wanted to go ahead and create a visualization that shows, across the age and across their housing status, their predicted probability of a disorder. And so we can see the predicted probability of the disorder on the y-axis and then their age on the x-axis. And then we're taking a look at the housing status as well. So if they have a housing concern, that is going to be the red line. If they have a stable housing, that is going to be the blue line. And so as we can see, individuals with housing concerns, and this is in our red line, consistently have a higher risk of mental health disorders than those with stable housing, and that's going to be in the blue line, across all age groups. Now, for both groups, we can see the risk of, decreases with age, but the gap between the two groups remains steady or widens slightly as people get older. This suggests that unstable housing is a persistent stressor contributing to elevated mental health disorder risk, regardless of age. And I think it's important as a researcher as well to apply things in context as you guys are doing your analysis as well. So you might see, okay, older people have, a lower predicted probability of a disorder, but it's also important to consider things like, maybe younger individuals or people, between that 2060 age range, maybe they are reporting, maybe they're more likely to report that they have a mental health disorder compared to our older population. So it's just important, and that's something to just think about as you continue on with your research and you do see different outputs and results. Next slide. And then I also wanted to do kind of a very similar graph, but I wanted to break it down this time by income bracket. So if they have low income, they are in the green. If they have medium income, they're in the blue. And then high income, they are in the red. And we can see that people with lower incomes are more likely to experience mental health challenges. And this gap grows larger with age. While everyone else's risk decreases over time, it stays higher for those with fewer financial resources. Higher individuals show a bigger drop in risk as they age, suggesting that having more financial stability may help protect mental health in the long run. So, again, just kind of breaking some things down. And as you guys are doing your analysis, you can switch out, different variables and stuff like that in your graphs and your visualizations to do some more predictions and things like that. Those are the two that I wanted to showcase for this one. Next slide. Next thing that I wanted to do is I wanted to show predicted probability of disorder by race and gender. And this is going to kind of show that intersectionality. And this is with a heat map. And so as we can see, we have our race variable on our y-axis, and then we have gender down at the bottom on our x-axis. And the darker colors show higher predicted probability of a disorder, and then our lighter colors are showing lower predicted probability of disorder. And so this graph ultimately is showing gender minorities that are classified as other face higher predicted disorder risk across all racial categories. And this is maybe pointing out to the impact of thank you. Pointing to the impact of gender nonconformity on mental health. And then exploring that intersectional identity, particularly the non-cisgender status combined with the racial minority status, it appears to be a strong predictor of higher disorder risk. The next thing that I want to point out is the Black individuals on this graph. And this is showing that they have a low model predicted risk. And, again, taking a look into and actually diving deeper inside your analysis, maybe this is suggesting that, maybe they do have a lower risk, but maybe this is also suggesting the differences in help seeking behavior, in cultural expression of mental illness or structural issues in diagnosis and reporting. So that is something that, if you were doing a secondary analysis, that you might want to take a look into, and maybe exploring the Black individuals and their rates of going, their frequency of going to mental health things to help them, doctors and stuff like that. Next slide. And then going into some conclusions and implications of the study overall, because that is where the next part of people's analysis would go, is to the conclusions. And so social factors of health, particularly income, housing, food insecurity, are powerful predictors of mental health disorder risk. Younger individuals, those with lower social economic status, housing concerns, and marginalized sexual identities are elevated or at elevated risk. And then again, Black individuals consistently showed lower predicted probabilities of mental health disorders, which may reflect the underdiagnosis, the stigma, or disparities in access to care rather than actual differences needed. Again, this would be something that I would go and explore a secondary analysis to take a look into to see if we can, kind of get additional background on those specific individuals. And then we can go into the Q&A, I believe. Alrighty. So I'm happy to take a few questions. Again, you guys can, and I see the claps and the hearts and things inside the webinar. So thank you all so much. And so I do see a question dropped inside the question and answer. And Angela, let me know if you want to read them off, or I can read them off. Um, Either way works for me. But I do see a question inside the chat.
I have no problems reading it, but this question was answered by Sula, if I am not mistaken.
Okay, perfect, perfect. And do you see the one in the Q&A that asked, do you have to do the training annually?
That's the one
Okay,
Sula responded to that.
okay,
But
perfect, perfect.
there is a question: how does a person get coding training?
Yes, yes. Actually, Daryl, that is a great question, because that is something. So, as Sula had mentioned, I'm coming from a background in statistics. So, in my program, I, was able to, get some background and training in, R and SAS and things like that. There's a few different ways that you can go and get training. And I think the best way that I recommend people to do is to download the software. I would probably recommend R because it is open source. It is a free software. SAS is a pretty expensive software. And I go in and just kind of like learn the syntax. There's some, resources online that allow people to see, different codes and snippets and things like that. But it's one of those things I tell people, the coding is not something that, people typically learn overnight. So it does take a little bit of time, but it's definitely doable. It is, kind of going in and just learning the syntax. But again, there's different things online. I think Coursera is a good course as well that's accessible to people learning, different coding softwares and strategies and things like that. R has different things like GitHub and things like that that people will kind of give a little bit more information to as far as their code and, what's going on with their code, what, their code is doing, what's the purpose of their code and things like that. And so that's what I would say is the best way outside of any type of school or institutional training, is to just kind of go into those resources and things like that, take a look at the different functions, very similar to Excel in a way when it comes to functions, like if you want to do a count or a summarize function and things like that. You'll learn those functions and apply those to the code, and then, develop the syntax over time. And then if you want to create visualizations and things like that, I would definitely take a look into different resources. There's like little snippets that will allow you to copy and paste the code directly into the software, and it will produce an output for you. Great question. I also see a message from Didi that says, as far as surveys, how do you know what surveys are available? That is also a very good question. I'm going to drop this resource in the chat for you all. And this is the Survey Explorer. And so I think at this point, it looks like there's, one, two, three, four, like 8 different surveys now available in English and Spanish version PDF, that will allow you all to see, what questions are being asked in the survey. Again, I was using the social factors of health survey. That is, that's a pretty popular survey. I do like to point out before people do their analysis, just to give you guys a heads up. So the way that the surveys are developed in the All of Us program, so all participants get the 3 base surveys. So they get the basics, lifestyle, and overall health survey. So those should be taken. And so the other surveys are optional surveys. So I always recommend to just kind of keep that in mind as you guys are doing your analysis, considering that there might be some missingness if you go to merge some data sets together. Great question. And then I also see one from Daryl that asks, are there other softwares that you recommend other than R? And that is a fantastic question as well. So I am R is my primary coding language, I would say. I think it just depends on what your goal for your analysis is, what you're trying to do, and how much data you're using, how complex your analysis is. I've used SAS for different reasons. I've used R. I am familiar with Python and their syntax, but I don't use it as often. But I think Python is also a really good coding software as well for machine learning analysis. So things that are complex, or if you really want to get into, complex data visualizations, I would recommend Python. Things like SAS, if you're working with like clinical data, if you're doing certain types of analysis, I think SAS is good as well. I think SAS is really good for cross tabulations, a little bit better than R in my opinion. But R, to me, I think that I like the flexibility of R and the things that you're able to do. I found that in R, you're able to do a little bit more functions and just kind of different visualizations and things like that. With it being an open source software, there's things that people have created, different functions and things like that, different libraries and packages. And so it really just depends, what software you want to use. I'm not going to say which one is easier. I think the thing about coding is just learning the syntax. And once you get the syntax locked down, that is probably when you will find a coding language of preference. But that is a very good question. In this case, though, remember on the All of Us platform, you have the option of SAS or Python, and that is the SAS and R. Are directly, or not the SAS and R, the Python and R are inside the Jupyter Notebook.
And Stephanie, I did want to mention that I included the link for everyone to our Researcher Academy course catalog so that you can access our various different resources. We do have an introduction to the Researcher Workbench module, and we also do have a notebooks one-on-one course that you can access. And so it provides an introduction to Jupyter notebooks for those who are interested.
Great. Thank you so much, Sula, for adding that. I see another answer in the Q&A chat in this question. This question asks, how can I use the existing V8 data to answer a research question about suicidal ideation and the history of suicide attempts while I wait for the mental health and well-being surveys to be added in the cohort survey drop-down menu? Do I need a search specific criteria or wait for the full survey to be added in the next rollout of data? And so this is a fantastic question. And actually, we get this quite a bit from researchers. We have researchers coming from different institutions and different locations that want to do, research on different topics, and they want to know what's inside the workbench and, can they actually do their research considering what's available? And so, the first thing that I do all the time, if I'm interested in a specific topic, is I go into the data browser. Now, I have gotten a few reports that I think that might be working on updating something with the system, so it's running a little bit slower today. But the data browser is a fantastic platform to type in certain things that you might want to look into. And I always like to let researchers know as well, if there's a topic that you're looking into and you don't find it initially, to try to type in different keywords or phrases that might work. So, like, for example, I had a researcher one time that was looking, they wanted to do, some research, related to, people that have been in jail. And directly, they couldn't find, jail inside of the, data browser and things like that. But they, typed in a keyword like incarceration and that popped up. So the first thing that I would do to answer this question, if you're interested in things like suicidal ideation, history of suicide attempts, is I would, maybe type in a keyword that might be, related to that inside of the data browser and see if it's there. And as I mentioned, the different types of tiers inside of the Researcher Academy workbench, we have the control tier and we also have registered tier, but there's also a third level, I like to say, that is considered the public tier. And so, you can go into that data browser, which is considered the public tier. If you haven't done your trainings yet or anything like that, you can go in and see, okay, is, what I'm interested in even up here in the first place. And so, to answer this question more directly, I would say, type in, suicidal ideation inside the data browser and things like that to see if it's there. I don't have experience with seeing the history of any type of attempts that a participant may have done inside of the workbench. I don't know if they've captured that, but it would be good to explore inside the data browser at first to see. But they do have different timestamps of certain things. If you can't, capture, maybe, some sort of attempts or anything like that, you might be able to see, okay, how many times have they reported, going to a mental health facility? How many times have they reported, this, on a doctor questionnaire or anything like that. So I think that's something to keep in mind. And yeah, and then I think the next thing to do would then be to wait until the survey comes out if you find that what's already available is not typically, what you're interested in. But very good question. I see a question. Oh, yes, from Angela in the chat, which is a great question as well. How do you identify and define social determinants of health in the All of Us data? So the way that I identify and define social determinants of health in the All of Us data, the first thing that I do is I go to the survey browser and I take a look at the social determinants of health. It's now called the Social Factors of Health survey. And I'll go into that survey and take a look into the things that are in there. As I mentioned before, when you go into your analysis, when you go into the coding software, you're going to have to do, some cleaning of the data. So you're going to have to do typically with the survey data, some transforming and things like that. But then I go in and I see the question, like, so I have this survey pulled up. And like, there's some, questions in the survey like that, is there a lot of crime in my neighborhood? Strongly disagree, agree, strongly agree. And so for me, depending on, what your goal of your analysis is, if you're planning on submitting this off, if you're doing a table presentation or something like that, a panel presentation, it's up to you how you want to essentially define that. But typically what I do is I go into the different literature and I see how others have defined that. So that's, typically my rule of thumb. So I want to make sure when I'm scaling variables, I'm scaling them based off of literature. So I'll go in and I'll say, okay, strongly disagree. I might combine a few different variables. So like, for example, I use the one, is there a lot of crime in my neighborhood? The next question on this, survey questionnaire is, is there too much drug use in my neighborhood? Whether you want to combine that or however you want to define that is up to you. But let's say we combine that, I then would say, okay, I combine those two variables together, then I'm going to put them on, or I'm going to actually put them on a Likert scale first. And then I, might average them out, combine them and things like that and define it as, neighborhood safety. And so that is typically how I identify and define social determinants of health inside the data set. Great question. I see another question that says, how do you just access the public tier of all of us? And that is a fantastic question as well. So I've shared did I share the data browser in the chat? Yes, I shared the Survey Explorer and I shared the data browser with you all. Now I'm going to drop this link in the chat and I'm hoping that this link works. And so this link is the Research Hub. And this link looks a little bit long. So I'm hoping this one works. If it doesn't, please someone let me know and let's see if we can get you guys an updated one. But this is gonna it should take you all to the All of Us Research Hub. And so this is considered the public tier data. So the public tier data is just what is available online, like the researcherallofus.org website. And so here we can see, different data snapshots, things about the data browser. Cool thing about that is it will show you like, if you're looking at, things, let's say I'm, focusing specifically on, depression, mental health disorder, the data browser will show you things like, top 5 or top 10, medications of people that are, have, depression or something like that, things like that. So that is, oh, great, Angela, let me know that the link works. It will also let you see things like project directory. So it will, tell you things about other researchers and, projects that they've done, which I also recommend if you are looking to, use this platform for publications, go in and take a look and see if, if people have done similar research and maybe you want to throw your own flair to it or something like that, or maybe if, exactly what you were, planning on doing has already been done, things like that. That is the public tier. And so you can, go into Google as well and just type in research all of us.org and that public tier will come up, which is really cool. All righty. And I see another question, and it says, use of the data here is considered secondary analysis, and we don't need to submit to IRB. So that is a really good question. Now, when you create your workspace, so once you create your researcher login, you'll go in and, then you'll, do your trainings and, verify your identification, things like that. And then you'll go in and you'll create your workspace. So like for my analysis, I created, a mental health, intersectionality type of workspace where I'm going in and I'm saying, this is what I'm doing. This is my goal. This is, my, aim and things like that. You can then, you have an option to, say, if you want your, project to be reviewed. So you don't have to, or anything like that. And Sula, feel free to jump in if maybe you know a little bit more about the IRB, but you do have the option to have your workspace reviewed. All righty. Great question. And I also see a question in the chat that says, where are you posting the link to the public tier data? Peggy, do you see in the chat? So I've dropped a few links in the chat and I can always drop them again in case maybe some people missed it. But so here is the Survey Explorer. And I'm going to pull up the data browser for you all as well. And all this is considered the public tier information. So again, think public tier, think like online, everybody can access that. Yeah. So data browser, and then also the research hub as well. I'm going to drop that in the chat. And actually, it's the same link. It's just as shorter this time around. So I'm going to drop this one. And that should all take you to the information that's able to be accessed publicly. Oh yes, actually that's a great let me and that might be let me actually show you all if that is easier. I just want to show you all if that's okay. How that public tier data would look. I should be able to share my screen. Angela, is that okay?
Yes, Keisha may have to give you permission. I'm not sure, but you can absolutely share your screen.
I think we should be good to go. I
Okay.
think I have had this access. Alrighty. Angela, Ursula, can you all confirm if this looks okay on your end?
Yep, we can see it.
Yes, it does.
Perfect, perfect. All right, so this is how the public tier will look. And so this is just the researchallofus.org website. And so here we can see where you can register and then your data snapshots. You can get click on this and get more data snapshots. This is what I was talking about with the data browser. So I'm going to click on this and allow us to see what pops up when we click on the data browser. But as I was mentioning before, this is where you can kind of go in if you have some topics of interest, you can type in different keywords and things like that to see if this information is available. So we can see, we have the EHR data, and that includes things like conditions, drug exposures, labs and measurements, procedures, the genomics data. Now, this is that data that's going to be on the control tier, and then the surveys as well. And so we can see the surveys that we have available. So let's see if, and as you guys can see, some of the things that popped up on my end as well that I've looked into. So some things like sexual orientation, education. That's a good example of like where I had to look into, like I wanted to see some information of schools, but school didn't pop up, education did. So some things like that, and like income and housing and stuff. So let's type in income. Again, the platform is running a little bit slow today, but here you can see it popped up. So there's some information as far as participant income data and the basics and then the social factors of health survey. So if I click on, let's say, the social factors of health survey, this is one of the questions where it says, what do you think the main reason for this experience is? And I think this is actually following the discrimination question. So I'm going to go into the basics, and that's going to ask the question is, what is your annual household income from sources? And so this is the public tier data because we can see these estimates. We can see the estimates of, what a participant may have said, and we can see the breakdown of how many people may have answered a specific part of the question, and things like that. So all this is public. Now, I say use this kind of just as like a baseline estimate type of thing, and then when you go into the platform, those counts will be more accurate. I'm getting the message that says the chat appears restricted to, oh, okay, okay.
I can share them while you go through that. I can share it with the larger group of attendees.
Okay. Okay, perfect, perfect. And then, yes, and so let's see, going back into the research hub, I want to pull up the survey browser, the survey explorer that I was talking to you all about. And that is right here under the data tools. And here you can see we have some about information. And this is really kind of where you probably all will want to be, with the Survey Explorer as well. That will allow us to see the different surveys that I was talking about, and their different versions, their PDF versions, the English version and the Spanish version. And then if I click on like the basics and the English version, we can see a PDF file of the questionnaire and how the participants got these questions. Great questions.
Stephanie, thank you so much. I have one other question that relates to analysis, and it is, what tools are available in the All of Us Researcher Workbench for data analysis? You've talked about it,
Mhm.
but if you could share a bit more, I think that may be helpful as well.
Yeah, absolutely. I'd be happy to do that. So, as I mentioned, so you'll go into your researcher workbench, and there you'll see your platform. Once you create your workspace, you'll go and do your cohort building, which is really user friendly. And you'll, create your cohort. So, if you want to select certain demographics, certain conditions and things like that, you'll go in there, and then you'll create your data set. And then once you go from your data set, that's when you'll have the option to go into your analysis. And so once you go into your analysis, you'll see the option of three different softwares available to complete your analysis. And so you'll have the option of R, SAS, or Python. And as I mentioned, the R and Python are inside of a Jupyter notebook. Now, the Jupyter Notebook is a platform that it's a very interesting one. It's not, if some of you guys are familiar with R or Python, as you know, you'll download R. The Jupyter Notebook is an online cloud computing environment, but the syntax that you're using for either R or Python is the same. So there's certain things that you'll see that are slightly different, but syntax is the same for R. Like you can still install packages, libraries, and things like that. SAS is going to be through SAS Studio on the workbench, but still, same syntax and things like that. So those are going to be your three coding languages that you can use for your analysis and things like that if you need to clean up your data.
Stephanie, one last question that I posted in the chat. Did you encounter any limitations in using the All of Us data set for this type of analysis?
Yeah, that is a very good question. I did. There's a few different things um, that with this data set, depending on what you're trying to capture, what you're trying to do, you might, get into some limitations. So I always like to let participants know as well, like as I mentioned, when you're dealing with the survey data, the participants have the option of like the three core surveys, so the basics, lifestyle, and then overall health. Data, and the other datas are optional. So that does include the data set, like the social factors of health. And so, when I'm pulling in my one data set, so I have my data set of people that don't have a disorder, and that's very large. And then I have my data set of the people that do have a disorder, and that's either the anxiety, bipolar disorder, depression, or PTSD are the four disorders that I chose. That data set is also very large. And then we go into the social factors of health. And so I want to combine those that have a disorder, with the social factors of health. And once you combine those data sets, you might get some missingness, data limitations. And so I think that's important for researchers to determine, how you want to handle the missing data, if there's a certain thing that you want to do to maybe reduce bias this inside of your data set and things like that. And those were some of the limitations that I encountered as well, in addition to, sexual orientation and things like, those cutoffs and things like that. So that's what I would say what my limitations would be.
Thank you, Stephanie. If this has been not just informative, but it has been interactive. It has been incredibly interested, incredibly informative. And using your examples from your own experience has just really enabled all of us to have a much better sense of how to navigate the data set and how to use it in a variety of different types of analyses. This was wonderful. Thank you so very much, Stephanie. Thank you, Dr. Hood, as well. Um, Keisha, if you can bring up the last slide. I don't want anyone to go anywhere quite yet, because as I mentioned at the beginning of the presentation, now is the time for you to take just a few moments and fill out the attendee insights, and then to stay around so that you can know when we are going to have our next webinar. So if you can just take a few moments, we'll give you a few moments now to access the survey and to submit it. Thank you as we wait and give you a few moments. Thank you so much. I see that Wanda has her hand raised. Wanda, we have about 1 minute left, so please feel free to ask a question. Okay, please put the survey link in the chat. What I may be able to do is to send that with the email. Thank you again for attending. Thank you for the questions, for your interest. And the next All of Us webinar will be July 10th, as you can see, at 2 p.m. Eastern, 11 a.m. Pacific, and it will be on intersectional differences, exploring healthcare barriers and access using the All of Us Researcher Workbench. Looking forward to seeing each and every one of you there. Please tell other associates and share in your networks so that others can benefit and learn more about the different ways that all of us can be used. Thank you so much. Have a wonderful rest of your evening and enjoy the weekend and summer weather. Thank you for attending.